Hey, it's Dave Hompers here from H-pylori and a quick video to answer a very popular question that comes in all the time, which is how can I tell my H. pylori infection has gone? Well, the very simple answer to that question is you cannot tell it's gone unless you run a retest. Unless you actually run some lab work to try and find H. pylori again, probably like you did in order to figure out it was there in the first place, you don't know whether it's still there or whether it's gone. Now, of course, you can go by your symptoms to a point. If you had a bunch of heartburn and bloating and you were feeling tired and depressed and all these other symptoms, and then you take the H. pylori treatment, and then all of a sudden at the end of that treatment you feel much better and all your symptoms have gone, it gives you a good idea that the H. pylori has probably been eradicated. The problem is that there may still be some rogue H. pylori bacteria hanging around in there. How do you know that in 1 month or 2 months those bacteria won't proliferate again and go back to a full-blown infection? And the answer again is you don't. You really need to run the appropriate test to find out whether the H. pylori has gone or whether it's still there. Now, when you're retesting, it's advisable to leave at least 4 weeks from finishing your treatment, whether that's antibiotics or herbs, until you retest. Why? Because you want to give any H. pylori that are remaining in the digestive system after treatment the chance to proliferate so they will in fact show up on a test again. If the numbers are too low, you may miss them on the test if you test yourself too soon after finishing the treatment. Next, you really don't want to be using a blood test to check for H. pylori eradication because the antibodies that they're measuring in your blood may stay elevated for months or even years after you've eradicated the infection. And so you may then unfortunately get a false positive reading and end up taking treatment after treatment after treatment and seeing that your H. pylori numbers don't drop down, when in actual fact, the H. pylori went away after the first treatment. So that's not a good situation to be in. So when you're retesting, it's advisable to use either a breath test or a stool test. Your doctor may recommend an endoscopy. I think that's overkill. You wouldn't want to use an endoscopy, in my opinion, unless you had ulcers or serious damage in your digestive system that the gastro specialist wants to evaluate once the H. pylori is gone. So when you're retesting, using a breath test or a stool test after waiting 28 days or more from the end of your treatment is the best way to check whether H. pylori has gone. Now, unfortunately, some doctors don't want to retest. And even if they want to retest, they may be constrained by medical budgets. And so you might find some resistance to being retested with your healthcare provider. If that's the case, we can help. Simply go to the website, hpylorisymptoms.com, and we can help you with an H. pylori retest or an H. pylori test for the first time, just to make sure that the H. pylori is gone for you. My name is Dave Hompers. I hope you've enjoyed this video, and I look forward to speaking with you again really soon. Thanks a lot.